Hi, my name's Melissa Miller. I've researched the Master of Public Health, and University of Washington has a local option for this. So as a person with a Master's of Public Health, or specifically this kind of a social worker, you can identify social and behavioral factors that affect health. You identify community, organizational, and individual concerns. You plan and implement public health programs. You describe social interventions and policies, apply ethical principles to evaluations, and identify multiple concepts and models to use in public health. So a lot of what you do is program development. You're very self-sufficient, and each job is very different depending on where you work. You can work in hospitals, DSHS, other state agencies, nursing homes, community health centers. And so you basically find the best way to complete a task, and every job will be very different. The Occupational Outlook Handbook says that social workers can get an average of $46,000 a year. So on the low end, that's $28,000. The high end, it's $68,000. But then also for Washington State, if you want to work, for example, DSHS, you can work as a social worker 3 for $80,000 to $100,000 a year. So Washington has higher wages, and there's a lot more opportunity, especially in the metro area. So this is a good occupation because it's growing, and it's growing specifically because of the aging population. The baby boomers are getting older, and they're going to need more social workers and public health administrators to help when they finally need health services. So by 2018, there'll be a 22% increase, and it's supposed to grow even from that afterwards. So in the 2-year program, you'll need 2 years of supervision during the master's program, and that's to get your license. It's similar to a licensed social worker, but it's public health, so it's more broad, and you can move into business offices and do different things with it. So some of the things you'll need is you'll have to be very mature. You have to be able to work independently and be self-sufficient. You might not have a boss. You might be your own boss. You might be a person who works solely within that department. So it's a department of one. So you have to have a high responsibility for what you do. And you have to build positive relationships with clients and between departments, because you may be the only person that people are coming to in your department. So you have to be able to listen well, objectively to what people need, and be very sensitive to their needs. A good place to start would be a social worker's assistant or an aide, or you can volunteer as a position within the county's public health office. So even if it's just filing paper, it gives you an idea of what you're getting yourself into and gets you some good contacts. So the University of Washington has a 63-credit program. It's a 9-credit thesis, 18-credit health services in-classroom courses, 30 credits graduate level in-classroom courses, and then the 3 credits practicum, that's at supervised learning. So if you're interested in the University of Washington, I've included the link for the curriculum and their contact at the bottom. So they have 3 concentrations. One is maternal and child health, social and behavior sciences, which I've italicized because it's closest to psychology and the closest to social work. You can also do health systems and policy, which is more on the ends of if you're interested in business or in politics and policy. So some of the things you'll need is at least a 3.0 GPA. You have to take time off and work for a few years. You cannot go directly into this program from having a bachelor's unless you have sufficient work experience. You'll have to do your GRE, resume, personal statement, and at least 3 references. So I had mentioned being a social worker's assistant or something for a few years. That would be a very good way to get into the program to get started. The application is January 1st for summer and autumn starts, so it's a very early application. So some examples of current local openings. You can do ERM Public Health Impact Assessment Consultant, so that's on the upper end. So this is after working quite a few years after you get your master's. You can work in an upper level position like that. You can also do Prestige Senior Living. This is kind of a nursing home type setting where you can start as a social worker assistant, you can move up to social worker, and then to community relations director, so move yourself up through the company. It's a good place to start with experience so you can learn under people to see what they're doing before you move into a position and just start with something completely new. There's also Harrison Medical Center, case manager, social worker. This is a position where you work with other social workers and you each have your own case of clients. So you won't be working solely alone. You'd be doing the same thing as other social workers, but you just have your own set of clients. And so the links are all there if you're interested in looking to see what they detail. And so if you're starting with a Master's of Public Health, you can likely start in the upper teens to the low 20s per hour, starting with basically not a lot of experience. Move your wages up into the mid-30s, even higher. And so it all depends on how much work you're willing to put in. All right, thank you for listening and watching my presentation.